Hi, how are you? Good. I'm Nicola. It's nice to meet you. I'm one of the chiropractors here at the clinic. Have you seen a chiropractor before? Okay, so this is your first time. Alright. And how are you feeling about that? I thought you were going to say that. So you're feeling a little bit anxious. Alright. How come? Okay. So you're worried about the pain. Okay. Okay, so you've been Googling and looking at YouTube videos. Alright. Okay, so you're concerned by the noise, which is the cracks, and you think it's going to hurt. Is that correct? Alright. Well, I'm a very highly trained professional, okay, and I've been doing this for a very long time. Okay, so you are in safe hands, I assure you, and I will explain everything to you as we go through. Alright, I'm not going to hurt you. You will probably jump slightly, but it will be such a relief for you. You'll actually find it quite pleasurable. Alright, yeah. Right, so it's your neck that you are concerned with. Alright, a lot of people do get worried about the neck because they think, oh, you're going to pull my neck and that's it. But no, it's not like that, don't worry. I hold certain positions and I move you in certain positions and press certain areas, and that obviously releases the tension and adjusts it back into line, if you like. Okay, but, you know, I'm not going to hurt you, so don't worry. Okay, alright. You sure? Good. So, I've got a little bit of information here about you, but if it's okay with you, can I just get you to just explain in your own words for me what's been happening and why you've decided to come to see a chiropractor? Okay. Right. Okay. And when were you diagnosed with that? Okay, let me just jot some notes if that's all right. Okay. Let's put your name on there first. Okay, so when you say a slipped disc, do you know whereabouts that is? Okay, so cervical 5 and 6, okay. Have you had any physio at all? Okay, so you've had a little bit, okay, and they recommended you come and see myself. Okay. Any other issues? Chronic pain, okay. Is that all over or is it in a certain area? Okay. Yeah, so kind of generally all over, but your worst kind of areas are your neck, head, cervical spine. Alright, okay. Do you get a lot of pain all the time, or do you have flares and things like that? Okay, and that's the fibromyalgia. Okay. Yeah, I do have a lot of patients that come to me with these issues, so I am experienced enough in those areas, so don't worry. Okay, yeah. Okay, is there anything else physically that I need to be made aware of? Yep. Okay. Just going back to your pain, on a scale of 1 to 10, 10 being the worst, what would you rate your pain in your cervical spine? Yeah, so quite extreme then, yeah. Do you take any pain relief at all? And what's that? Okay, and how often? Perfect. How's your posture? Okay. Yeah, just by sort of looking at you, I can and see what you mean. But don't worry, I'll have a look for you. And what is your job? Okay. And are you bent over a lot? Are you on your phone a lot? Tablets, things like that? Okay, yeah. Yeah. Yeah, which is typical. Yeah, okay. That's fine. Do you experience any headaches or migraines? Okay. Whereabouts? Okay, is that all the time? Okay. Yeah, I'll have a good look around and I'll have some feeling around and some tapping and things like that on different nerves and things, alright, and just see how you react to that. Yeah. Okay. And who was it that gave you all these diagnoses? Okay, a rheumatologist. I take it you had MRI scans and x-rays and things like that. Okay. Perfect. What was the recommended advice from the rheumatologist? Yeah, then how many sessions have you had so far? Okay. And what else? Okay, so exercise, stretches, possibly acupuncture. What else? See, chiropractor. Yeah. And did they suggest any lifestyle changes to you or anything like that? Okay, so just adding on massage, okay. Yeah, so physiotherapists can do a certain massage, okay? And then you have sports therapists, which we do have one here at the clinic, okay? And they obviously work a lot on injuries and things like that. So somebody in your situation will probably get on better with a sports therapist rather than, say, just your local spa or something like that, having a massage with them, okay? It's better to go with somebody that's more highly trained in a specific massage. All right, yeah. And obviously, again, the physiotherapists do a slightly different kind of, massage and things like that. I do slight bit of manipulation and massage and things like that, and I use certain tools and things as well. But, other than, that, I don't particularly focus on massage. All right, but I'm a little bit like sort of do some things that a physiotherapist would do. So like get you to do certain stretches and things like that. Okay, yeah, but it's just all incorporated on how I do my work, if that makes sense to you. Perfect. Okay. Just turn this over. Just tell me if you're allergic to anything, and are you on any medication? Yep. Okay, that's fine. And is that everything? Good. Great, that's fine. Have you ever had your balance looked at? Okay. Your cranial nerves? Okay. What about your brain waves or anything like that? Okay. And what about your heart? Okay. When did you last have a doctor review at your local surgery? Okay, so about 6 months ago. Okay. And was everything okay? Good. And I take it you're up to date with all your bloods and things like that. Perfect. I ask quite a lot of questions just because I do like to build up a profile on my patients, so I know their background and things. Yeah, it really does help when, I'm working with obviously a client that I know a bit about their history and things like that. Yeah, and it helps me sort of understand you as a person and about what you do and what you don't do and things like that, and how I can actually help you and incorporate that in your daily life. And I just need to obviously make sure, that I'm not using anything that you're allergic to or, anything like that. Yeah, that's right. It's just obviously safety for myself and obviously for you. All right. Okay. Do you know how tall you are? Okay. And do you know how much you weigh? Okay. And what size shoe are you? And what size clothes do you wear? Wonderful. Excellent. So, at night when you go to sleep, or in the day, whenever you sleep, are you comfortable? Can you get into a comfortable position? Okay, can you just show me how you would typically lie? And would that be all the time? And if it wasn't that way, how would you be? Right, okay. How many pillows do you have? Okay. So if you could just sort of show me how you're lying on your pillow, if that makes sense to you. So just imagine you've got a pillow and just sort of show me how you would do that. Okay, and whereabouts would the pillow rest? Okay, you can relax. Excellent. Do you ever experience any pain in your lower back, or in your knees or ankles, hips, or anything like that? Okay. What about any other joints? Okay, so that's sort of looking into that. Okay, that's fine. So, what I will need to do is just briefly carry out a body exam. All right. Yeah, so I'm going to be checking the areas that are of concern the most. All right, so I'm going to have a really good feel around at the bones, the joints, and around by the muscles, tendons, and things like that. Okay, I just want to see how they are infused together. All right, yeah, and see if I can fill any air pockets and different things like that. Okay, yes. I also want to have a look and feel around on your head, any trigger points, any nerves and things like that. Okay, and just do some taps and things. Would that be okay? Good. And I want to just examine obviously your jaw, concentrate obviously on your neck, cervical spine, okay, and your shoulders. As you've described to me, that's where your main concern is. Yeah, so if I can sort of concentrate on this kind of area, that would be a good starting point. Yeah, I mean, I can do a full body adjustment, which I do those, and that's perfectly fine for me to do. But sometimes I do like to just concentrate on, say, a small section at a time, and especially if there's one area that is really of a concern to you, I would like to concentrate on that area. All right, but I'm probably going to have a look at your wrists and things like that, if that's all right. Okay, wonderful. So, once I have done the body exam, I'm going to do some adjustments. Okay, Then I will do some manipulation, a little bit of massage in certain areas, and then that is our session complete. All right, good. Do you have any questions for me? Are you sure? Okay. If you do think of anything, please just ask me and I'll happily answer. All right, good. Perfect. Right, gloves are on, you're comfortable, good. So, if you could just sit for me as you would sit normally first. Okay. Any pain anywhere? Yeah, whereabouts? Okay. Now, can I get you to sit right up for me, properly? Shoulders back, like so. So you've got a nice, straight spine. Good, hold it. How do you feel? Any pain? Okay. Is it the same pain as what you were getting a minute ago? Okay, so it's different, yes. And is it in a different place? Yes. Now that is because your muscles there are weak and they are not used to you sitting in that position. All right, but if you are slouching and sitting in those positions where obviously all the problems are, you're going to be getting the pain from the irritation, the fibro, and obviously the slip disc and things like that. Okay, yeah, that's right. You can just sit how you're comfortable. All right. Okay. What I'd like you to do first, if I could get you to raise your arms right up for me, just in a nice warm sweep. And back down. And back up again. And back down again. Perfect. Can I get you to just go like that? And like that. And like that. And like that. Good. And can we do the same with that side, please? Good. Now can I get you to go like this out front of you? Good. Feel okay? Perfect. Now, if I could get you to just rotate your head for me in a big circle. Okay, and back the other way. Where's the pain? So we're talking about here. Right. Okay. Right. Is it okay if I just have a feel around now? Alright, thank you. Start here. By your jaw. Push right in there. Any discomfort? Okay, just open your mouth for me and hold it. What about there? Close it and open close. Again. So I can hear a clunking. When you chew, can you hear that clunk? Okay, so on hard things. Alright. Have you been to the dentist recently? Have they ever said to you that you grind your teeth or anything? Okay. Have they ever mentioned anything about your jaw not being in line or anything like that? Okay, so not particularly. All right. Okay. Just feel that part of the jaw. Just open for me. Thank you. Close. Thank you. Good. Okay, just going to touch this right side. Okay, just a bit discomfort. All right. When I go like that on your collarbone, how does it feel? Okay. And what about that? Okay. Really true. Just going to press. A bit tender. What about there? Same. Okay. Yeah. Let's see. I can just get you to just raise your shoulder for me. That's it, like that. And that's it, just back down. Okay, back up. Good. And relax. The other side. I'm just going to press there. How's that? How about that? Okay. And then get you to just shrug for me. And back down. And up again. And back down. Okay. If I can just have your arm, okay, just pop it on there for me. Okay. That hurt at all? No? Good. Any pain there? Okay, I'm just going to rotate your wrist. Does that hurt? Good. Does it all sound like that? Okay. Okay, put that back. And can I have this side? You just pop it there for me. Thank you. Good. Okay. Any pain? Okay. Good. Any pain at all? Okay. Just going to rotate your wrist. Okay. Can I get you to just squeeze my hand for me? As tight as you can. And release. Okay. And can we do the same this side? Squeeze my hand. Good. And release. You're doing really good, don't worry. Okay. Perfect. Can I get you to just stand up for me? Just walk backwards. That's fine. And come back to me. Good. Okay, you can relax. Do you normally experience slight cracks like that, or? Fine. Just going to press certain places. If you And just tell me how it feels. Okay. Okay, I'm just going to press. 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 Okay. Press. Press. Okay. Press. Press. Again. Good. Now, I'm just going to rotate your head for you, okay? What I need you to do for me is just relax, okay, totally, and just let me do the moving, alright? Okay. Good. Good, well done. Okay, wonderful. So you definitely have some restriction when I'm moving your head in different directions, okay? Did you feel any pain at any time? Okay, and was that roughly the same place? Okay. Alright, I'm just going to go around and feel around the backs of your shoulders and down your spine, okay? I want you to just stay there nice and still for me, okay? Yep, right there, okay. I'm going to press there. How's that? Okay. Okay. And press that. How's that? Okay. Alright, now I'm going to come and adjust your shoulders. Okay. Okay, so just pop there, that's it, perfect. Alright, so take a nice deep breath in for me. Release. Take a nice deep breath in for me. And release. Good. Deep breath in for me. And release. Wonderful. How's that feeling? Good. Same on the other side. Okay, we'll hold that. Good. Okay, nice deep breath in for me. And out. Good. And again. Good. Well done. Nice deep breath in for me. And release. And in. And release. Take a deep breath in for me. And release. And again. Good. Well done. How are you feeling? All right? Good. That's fine. Just going to hold that. I'm going to press. Take a nice deep breath in for me. And relax. A nice deep breath in for me. And relax. And nice deep breath in for me. And relax. Well done. Keep in that position. Good. Nice deep breath in for me. Relax. Good. Well done. Nice deep breath in for me. And relax. Good. And again. Well done. Deep breath in. Good. Well done. I'm just going to press another position. And deep breath in. Good. Well done. Keep like that for me. Take a nice deep breath in for me. Great. Nice deep breathing now for the last bit. Good. Feeling all right? Wonderful, wonderful. Okay. And the last move is I need to bring your head down. Okay. So relax for me. Take a nice deep breath. Hold it. Release. We're very tight there, aren't we? I'm going to have to probably do one of those again. Deep breath for me. Okay. You ready for one more go? Deep breath in for me. Good. Perfect. That's well done. Well done. Excellent. Okay, just let you adjust yourself. Okay. How are you feeling after that? All right. Wasn't as scary, was it, as you thought? Okay, that's good. just need to do some tapping in certain areas. Okay, just stay nice for me. Okay. Good. Wonderful. Okay. What I'm going to do is just do some manipulation just in your neck, your cervical spine area. Okay, good. Now, I just need you to stay in exactly that position. All right, but just relax for me. Okay, I'm just going to use these just to do some slight manipulation in certain areas. Okay. No, it won't hurt, don't worry. I'm not going to be properly massaging you. I'm just going to be using this, and you'll see that I'll be going like this and things. Okay. And some areas I might just push slightly, and it might just make a bit of a pop or something like that, but it's perfectly normal. All right, my lovely. So you keep nice and still for me. Are you ready for me to begin? Good. Feeling okay? Good. You okay? Good. Okay, I'm going to do some pushing, and you may hear a crack or a pop. Just breathe if it helps. Deep breaths. Keep breathing. Okay. Good. Well done. Excellent. There we go. Excellent. So how's that for you? All right. Good. So that is our session complete today. Just going to jot some notes down. All right. If you do have any questions, can you please think of them, and then just feel free to ask me them whenever you're ready. Okay. So how was it for you? Did it hurt, or? Okay, a little bit of pressure and discomfort, okay. But it wasn't painful. Okay. And how do you feel now? It's relief. Okay. That's what I like to hear. Okay, I want you to take it easy for the rest of today, okay? And just relax your head and your neck and your shoulders, all right? Yeah. Okay. We've got some different things we can try during the sessions as well. Okay. Okay, so that was that one. Yeah, okay. I would like you to just monitor how you're feeling, okay, from now until, say, when I next see you or something, all right? And just see how things are going for you, if they've improved, if they're getting worse again, at what time does it get worse, all sorts of different things like that. Any information that you can think of, just jot it down. The more I have, the better, all right? So you're all nice and in line now. You may want a full body adjustment next time. That might be of some use to you, but just see how you get on with what I've done at the moment. Okay. Excellent. And do you have any questions? Okay. Are you sure you're happy with everything that we've discussed, that I've done today? And are you feeling all right? Good. Perfect. Wonderful. So, that is everything complete, all right. I will get my secretary to contact you with your next appointment, all right. Yes, we need to just check the diaries and things like that, okay, and just work out when the next time is right. We don't want to do them too close together. Yeah, all right. You are very, very welcome, my lovely. You take care now. Bye-bye.